Knee surgery or exercise if you have a meniscus tear? Well, we've got more research coming out that's showing it's harder and harder to justify a blanket recommendation for arthroscopic meniscectomies or shaving away the meniscus when both short-term and long-term data is showing exercise is a very effective and oftentimes preferred option. So the British Journal of Sports Medicine just published a study that is a 10-year follow-up of the OMEX randomized clinical trial. 140 people with meniscus tears without signs of osteoarthritis in the knee were either randomly assigned one-to-one ratio to either getting a partial meniscectomy, the most common surgery that you see for meniscus tears, or 12 weeks of exercise therapy. Both outcomes and strength were the same for both groups. And at the 10-year mark, they looked at progression of knee osteoarthritis on imaging. And they found that the group that got surgery had 23% incidence of OA and only 20% incidence in those that did exercise. Very minimal, but that's kind of the point that we're not seeing a difference really in outcomes across the board. Knee OA, strength, or pain function, but one has a lot more cost, a lot more risk associated with it when we talk about surgery. And the other one that focuses on exercise brings all the other health benefits that come with exercise, like improving strength, muscle mass, metabolic health, your cardiovascular endurance, VO2 max, all those things that are really important for your total body's health, longevity, and so forth. Now, there's going to be individual cases, right? When you look at these studies, they look at the population, they look at the full group, they're comparing 70 in one arm versus 70 in the other. But these results are similar to other studies, both short and long term, that show arthroscopic partial meniscectomy should not be the default. Now, if there are cases where there's failed bouts of care where physical therapy or exercise did not work, they have extreme excruciating pain that's preventing them from sleeping or preventing them from doing their daily physical activities, then perhaps there might be a case where a partial meniscectomy is needed. But that shouldn't be the first line. The first line should be a comprehensive, conservative approach that really focuses on exercise, not surgery.